So when I think about functional medicine and why I chose that, it goes back to some of my upbringing, because I grew up in the Caribbean, and we barely went to the doctor because my mom made sure that we had good food, we were outside, we had access to fresh air, we went to the beach, and it was just a very holistic life, very natural. We didn't have a lot of we didn't eat a lot of chemicals, we didn't eat a lot of processed foods and stuff like that. And so it kind of reminds me of going back to my roots, but also more importantly, asking the question of why. Why is it that these symptoms are coming up, as opposed to, oh, let me just give you something to calm the symptoms.
Welcome to the Prospective Doctor Podcast, brought to you by Med School Coach. Pre-med and medical students alike are encouraged to tune in each week for tips on how to become a strong med school candidate, gain acceptance into the school of your dreams, and succeed on your journey toward residency and becoming a doctor.
Hello there. We are here with another special guest, Dr. Janice Brown. I'm just going to give you an opportunity to tell us a little bit about yourself and your journey to medicine.
So, hi, thank you for having me on your podcast. So, I consider myself to be, I guess, in the proper world, non-traditional. I actually took 6 years off between undergrad and medical school. And during that time, I was an entrepreneur, as well as I also did research in Uganda for 3 months. And, my journey to medicine, I always knew that I wanted to be a doctor. But I think as I've gone along, I think the draw was, I knew I was a healer. Not so much the doctor, but that's what I knew then. And so I made up my mind. I was 5 years old, and I kid you not, I was 5, that I said, okay, I'm going to be a doctor. And I just kept that, that drive to become a physician. I just kept it, and I just did it.
I totally get that. And it's very interesting speaking to a lot of physicians who come on the show and they're like, I was non-traditional, but everybody's journey is their own. And I think that that's important for the students listening to know that although you may have the drive to be a doctor, or life happens. Yeah. So it's okay to have another career, to go do research in places like Uganda and to do other things. And I actually encourage that because a lot of students, especially doctors, are kind of type A, and we want to check those boxes and say, okay, by 26, I'm supposed to be here, and here is 30. But that's not life. So, of course, there are people who go straight through. There are people who may have bumps in the road, or people who want to explore other things. And that's okay. I kind of tell the students, if there's anything you could possibly think about wanting to do besides be a doctor, try that first. And then if it's still your calling, then come back to it.
Yeah, that is true. Yeah. I mean, I guess I did do a little bit of that because I could have, I did research not just in Uganda, but in New York City. And, I could have said, okay, I'm going to be a researcher, or I could have just kept my business, my entrepreneur business, which is actually as a massage therapist. And I could have just built up that business. But that I knew that was not where my passion was or my soul was. I knew that. And so I think that, just allowed me to be able to put on my blindfolds so that way I can focus on what, the goal, which is getting into medical school and completing it and doing a residency.
Awesome. So now you're a PM&R doctor. Mm-hmm. For those who may not be as familiar with the field, as physical medicine and rehab or physiatry, there's so many different aliases that you guys have.
Yeah, I know.
And I think that's pretty cool. And it seems to have it's very interesting to hear that you had a massage business before becoming a PM&R doctor, because you got to know all of the different parts and the muscles and stuff. So it kind of is a part of your journey.
Yeah, it actually complemented what I do. And when I was in medical school and about to choose residency, I actually applied to both family medicine and PM&R programs. And I think I did both because I just wasn't sure, if I would get into the PM&R program. I had a really good chance, but sometimes you have these doubts. It's oh, let me just do this just in case. And so, because family medicine was also interesting to me. The one thing I didn't like about family medicine, what I found was not encouraging was the fact that a lot of times the patients would keep coming back and they weren't getting better. And for me, I believe in trying to find a root cause of illness to try and explain, not just say, okay, let me just give you something to, to fight the symptoms, to control the symptoms, but let's try and figure out what is going on. And I think with physical medicine and rehab, we were able to do that because, especially with the musculoskeletal exam, we can find out what's generating, the pain. What is the etiology? What's the source? And not just like musculoskeletal, but we also do nervous system because, we kind of like the way I think of PM&R, we kind of bridge both worlds between being a neurologist as well as an orthopedic surgeon in some way, like the non-surgical orthopedic surgeon, because we do both. And so you get to try to figure out what's going on and you actually see people get better.
I love that answer. And it kind of went into what our next question was going to be. I think you kind of answered it, but to kind of frame it in a different way, some students may be torn when they're thinking about what they want to specialize in because there are so many options and so many avenues to treat patients with sports injuries and things like that. So some people may decide to go the orthopedic route. Some people may decide to be a PM&R doctor, or some people may decide to go the primary care route of a family doctor or internal medicine doctor because they can do sports medicine.
Yeah.
And sometimes the different specialties may work together in clinics or work on the sidelines in the field and things like that. And it seems like what you were saying, it kind of seems like what type of training do you want? What type of life do you envision after training in terms of do you want, yes, there are sports medicine doctors who are primary care, but a lot of their original training is seeing the whole person and seeing them from cradle to grave for 30 years and getting into all their problems and other things.
Yeah.
I say that because I'm a family doctor.
Okay.
And while you can sometimes have like a sports medicine clinic or go and subspecialize, a large part of your life will be a part of that. Whereas in other fields, you may be able to dive a little more deeply, like you said, into like the neuro system without being a neurologist. Or as a orthopedic doctor, you are in the OR as a surgeon. So just figuring out what your personality type is and what you think you want your practice model to look like in the future and the near future with training is very important.
Yeah, that is true. Because I remember going through medical school and like, what am I going to choose? And I knew I didn't want to do surgery because I don't like standing on my feet for prolonged periods of time. That's just not who I am. I recognize that, and I like to sleep. And I thought I was going to do OB-GYN, and then I realized I'm like, babies come whenever, and I need sleep. And then I thought about pathology, and I did a rotation in the Department of Health, and I was doing autopsies. I actually was witnessing autopsies, and I'm like, well, I kind of want to talk to people. And so, it kind of led me down. And then I thought about, of course, my background. I just decided that it just merged. But I'm not sure if this is going to be a question in your next question. But the other thing is that you don't have to like pigeonhole yourself in just your specialty. Because what I did is while I was in residency, I actually did a training in acupuncture. And so I actually do acupuncture right now. I average about like 4 patients per day in clinic where I'm doing actual acupuncture, mainly for musculoskeletal, pain, most of the time low back pain, headaches, neck pain, that kind of stuff. But I'm also able to influence and help people improve their energy, help them sleep, help them with anxiety, help with their GI issues. And then I also, because I believe in finding or trying to get to the root cause, I actually went ahead and got certified in functional medicine because that's what I believe in. So the thing is that just because you decide on a specialty doesn't mean that you can't open up your world.
I love that. And that is so true. Like there are so many different certifications that you can get after completing residency. There are so many different programs, fellowships, and even things that don't necessarily need a fellowship where you can learn more about and bring it to your patients. I love that you mentioned acupuncture because a lot of times when we're trained with Western medicine, we don't think about bringing Eastern medicine, but a lot of times it works. It may not be as much research-based here in the US, but there's a lot of evidence that those interventions work. You brought up that you also practice functional medicine. Can you kind of explain to our listeners, most of them are pre-meds and med students, what functional medicine is and how they can explore that in the future? And sometimes people may have questions like which avenue to go. Should they go functional medicine or lifestyle medicine? Because a lot of times we have our basis taught in medical school, but they can't teach everything. And we know that we need to, they've heard about it on our podcast about how the medical education system needs to be transformed because we've been kind of stagnant for like 100 years. But there are a lot of different things out there that we can learn about.
Yeah. Great question, and thank you for the opportunity to explain it, because I think that's important for people to know. So all functional medicine is looking at a person, their symptoms, and understanding the root cause of the disease process, taking into consideration what you mentioned, lifestyle. So with functional medicine, we go back as far as their birth. Okay, what kind of birth did they have? Were they vaginally delivered? Did they have a C-section? Were they bottle fed? Breastfed, what kind of, did they have antibiotics early in life? Did they have multiple antibiotics because of, ear infections or whatever the case may be, for respiratory infections? Because those are the two common things in children. And then we think about like all the stressors, what things they've been exposed to in life. Of course, looking at, their sleep hygiene, looking at what they're eating. Eating is key. Their diet is key. Also looking at their work stressors, what they're doing, are they doing what they love? Do they have community? Are they in a good relationship? For the most part, like looking at all aspects of their life and trying to understand which part of their life they probably need. Of course, exercise, I didn't mention that, but, are they exercising? And so when I think about functional medicine and why I chose that, it goes back to some of my upbringing, because I grew up in the Caribbean, and we barely went to the doctor because my mom made sure that we had good food, we were outside, we had access to fresh air, we went to the beach, and it was just a very holistic life, very natural. We didn't have a lot of we didn't eat a lot of chemicals, we didn't eat a lot of processed foods and stuff like that. And so it kind of reminds me of going back to my roots, but also more importantly, asking the question of why. Why is it that these symptoms are coming up, as opposed to, let me just give you something to calm the symptoms. And so functional medicine approaches it that way. So it also incorporates lifestyle, because exercise and so forth. So for me, I love exercising. I tell people that, they think I'm crazy, but whatever. But I can design an exercise program for anybody, especially, as people get older, they're not going to be able to do the same things that they did before. And so I do focus a lot on that lifestyle aspect. And so when my patients come to me, because I primarily do, pain management, I'm not just, giving them pain medications. Also asking about their lifestyle, their well-being, their stress levels. What are they doing to combat that? And then, of course, talking about diet and exercise.
I love that. And it's very important because, like you said, we need to get to the root cause and figure out how to help people. And patients don't read the book. So it's okay to go through their history and kind of figure out okay, how has your life been, your journey? What trauma have you experienced? Because we all know that certain things in life can affect how you live and what kind of diseases you get. Like you mentioned, in your upbringing, there wasn't a lot of pollution. There was whole foods. There was all of these different things, and you weren't sick very often. But a lot of times the exposure in certain environments can cause these things. So it's okay to ask questions and not rush the patients out.
Yeah, that's key.
So, as you mentioned, you're an entrepreneur. You have figured out ways in which to enrich your medical practice to bring in other avenues of treatment for your patients and things like that. I've talked to a lot of guests on our show and come to the conclusion, along with others, that sometimes people can get lost in the identity of being a doctor. But that's really just a component of who people are. There are so many different factors and facets to that. how would you advise one to practice medicine in a way for them to remain creative so that they don't get lost in the practice of medicine?
Yeah, that's a really good question. I would say, if there is something that you enjoy, a hobby, just do it, right? Because a lot of times when you're in the throes, especially, I think medical school is a little bit easier because, granted, yes, the first 2 years is didactics for the most part. Last 2 years, you're clinical. But you don't have as much as a responsibility as you do when you're in residency. So I think once residency kind of starts, like people still hold on to some of those like things that they enjoy, like things that they would do on a regular basis. They hold on to it in medical school, and then once residency hit, because now your hours are longer, especially that first year. That first year is just like such a steep learning curve. And then for those who are doing specialty, like you may have to do like a transitional year, or that first year may be like in internal medicine, and then you go on to your specialty, whether it's a surgical specialty or whatever. It's hard. And so you lose all of those interests and hobbies that you had because you're expected to be in the hospital. I would say do your best to sort of hold on to those, even if it's just maybe not doing it as frequently as you may have done it before. Next thing is, I know a lot of times when you're rounding, or at least when you're learning, especially when I mention rounding because I always remember like rounding in internal medicine and just seeing how people were. And it was like, oh, that doesn't fit me. So really and truly staying true to yourself in terms of how do you see the practice of medicine? How do you see interacting with patients, irrespective of what you learned, right? Some of that may be influenced by, your interaction with physicians yourself, years prior. I mean, I remember I took my younger sister, I had to take her to an OB-GYN, and this was in New Jersey, and she was like super efficient, but also nice. Like she really took the time. And so I wasn't in medical school then, but obviously I knew I was going to go into medical school. But I looked at her demeanor and how she did things, and I'm like, okay, that is kind of how type of doctor that I want to be. And then, of course, in residency with, various attendings, I kind of focused in on the ones that I'm like, yeah, that kind of fits who I am. And so I kind of, would not necessarily emulate, but I'd talk to them about how they do things or observe them and see how they did things. So for me, what's important is efficiency in seeing patients, as well as being personable and being able to know my patients. Like I guess it's a skill set now that I've developed where I can get the information that I need from a patient in a shorter period of time without them feeling rushed. Like I could still have that 15 minutes and they will say, oh my gosh, thank you for spending so much time. Even though it was like maybe 15, 20 minutes, but it's the type of questions that I've asked or that I ask of them, and then just how I come across. So I sit down, I don't appear rushed, I look them directly in the eye. So that kind of slows down time and, allows them to make them think that, hey, she's spending time with me. When in actuality, I'm spending the same amount of time as I would with anybody else. So, I would say pay attention, look for, examples through your attendings or even other people who are practicing medicine in a way that you think. And then as you go along, you just tweak it to your liking. Don't be afraid, right? It includes the notes. Your notes don't have to be the same template or written the same way as a colleague who showed you how to write it. It could be tweaked to your liking as long as you have all the elements and you're getting the information that you want. So that's what I would say. Just practice medicine the way you want. Hold on to your hobbies and your loves and your likes and things that you enjoy, and still try to do them as much as you can.
I love that. And you've shared so many pearls of wisdom. Two, I'll point out. One, stay true to yourself. Don't lose it. Even if you have less time, just find a way to fit it in, because medicine will be there. You need to have time to practice well-being and being a person. And the second thing is kind of mirroring those people and taking those things you love from the people that you encounter and your teachers. It's funny. I OBGYN was not for me. I'll say that. But I definitely in medical school made a promise to myself to mirror my clinical care in the clinic after one of the OBGYNs that I was with for my rotation. Shout out to Dr. Sia if she's still at BU. But she just had a wonderful patient bedside manner. We had, since all of our patients were girls, we had homegirl time where we would pick the topic of the day and ask every patient the same question and just see how they did it. I'm dating myself, but this is when Prince William and Kate got married. So we were all like, what'd you think about the dress? What'd you think about the dress? So those types of things are important to kind of build that rapport with patients.
Mm-hmm. Yeah, absolutely.
So I loved all of our conversation. I think you shared a lot of great information for our listeners. I just want to give you an opportunity to say goodbye and how our students can reach out to you if they have any questions.
So they can just contact me via email. I actually have my own website because I do have a life coaching business that I do. So I guess I'm an entrepreneur at heart. So I practice medicine and I still have life coaching that I do. So they can reach out to me. They can go to my website if they wanted to do a consult. But my email address is Janice, JANICE at betterhealthlifecoaching.com. And that's spelled out. So it's a long email, but just betterhealthlifecoaching.com.
And is betterhealthlifecoaching.com also the website that they can use if they want to coach? So you guys have heard over the past few months, different coaches. So if you resonate with Dr. Brown, just definitely reach out and just ask questions because coaching can be so helpful with getting through the process of different parts of your medical journey. Yeah. So I'll just ask you guys to click that subscribe button, share this video. We are on YouTube now, so you can look at us there and you can find us wherever podcasts are found. See you next week.
All right. Take care.
Each episode of the Prospective Doctor podcast is brought to you by Med School Coach. To access articles, videos, webinars, and free tools to help you succeed on your journey toward medical school and beyond, visit our website, prospectivedoctor.com. We hope you tune in again next time.